Hello, how are you? I'm gonna shut the door for some privacy. My name's Tatum. I'm your nurse today. Are you want to get a physical assessment done?
Yes.
Okay. You have to use the bathroom?
No.
Okay. Can you go ahead and tell me your name and date of birth?
Braxton Burden, 82593.
Do you have any allergies?
No.
Okay, I'm gonna wash my hands here. Okay, so just taking a quick look at you. You appear to be well groomed. You appear to be pleasant, cooperative. Your BMI and your height look to be adequate for your age. Your body distortion and everything seems to be appropriate for your age as well. Do you use any assistive devices?
No.
Okay. I'm going to ask you a couple of questions just to kind of judge your judgment and your orientation. So, do you know where you are today?
Doctor.
Okay. Do you know what date it is?
Tuesday.
What time?
8 o'clock.
Okay. Do you know who the president is?
Donald Trump.
Alrighty. And for judgment, if your house was on fire across the street, what would you do?
Dial 911.
Okay. So you're oriented and alert. Your oriented time's 4. Your judgment is intact. Your speech is clear. You're pleasant and cooperative as far as your behavior. And as I said, your appearance is to be well groomed. For a white Caucasian male, your skin is intact and it is an adequate color for your ethnicity. It's concurrent with your ethnicity. So I'm going to go ahead and look at your head. It's symmetrical to your body. It is a symmetric size. It's normocephalic. You have muscle control of your head. I'm going to look at your scalp. The hair is distributed evenly. I'm palpating, inspecting. I don't feel any protrusions or lesions. There's no tenderness noted throughout there. Taking a look at your eyes. Your eyebrows and eyelashes are distributed evenly. Your eyelids are intact with no lesions. Your sclera is white. Taking a look at your conjunctiva, just pulling down. It is pink and moist and intact as well. I'm going to take a look at the size of your pupils, just measuring with a little measuring gauge here. It looks like they're 4 millimeters. So the first thing that I want you to do is, I'm going to get my light here and just focus on my nose here. I'm going to shine a light. Okay, so you have equal pupils in size. They're round, reactive to light, direct and consensual response. If you want to fix your gaze on that spray, please. Okay, and then my finger here, point it to my finger, look at my finger, and then follow it in and out. So for him, Perla is intact, so his pupils are equal, round, reactive to light, and accommodation. For the vision test, I'd like you to go ahead and step over here. We have a Snellen chart. If you want to stand for me. Typically with a Snellen chart, they ask to be 20 feet away, but this one was downloaded from the internet, so it's a little bit smaller. So on here specifically, it says 10 feet. So with both eyes open, do you have any contacts in?
No.
Okay, so if you want to start at the top line, read as far down as you possibly can for me.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C. That's it.
Okay, so that line is 2025 with both eyes, no letters missed. You're going to cover your right eye and read with your left, please.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F. That's it.
Okay, so that is to the 2025 line with 4 letters missed. So you can go ahead and cover the other one and do the same thing.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C. That's it.
Okay, That is 2025 with no letters missed in the right eye. So you can go ahead and have a seat for me. I don't have an ophthalmoscope, but to use an ophthalmoscope, I would start with the right eye, with my right eye in my right hand, and look through it, and I'm visualizing for a red reflex. The other side, I would do with my left eye, with his left eye, and my left hand looking for a red reflex as well. Okay, so the next area that I'm going to assess is your ears. So if you want to face the camera for me, this side is the left ear, the pinna, the tragus, and the mastoid. Are there any tenderness areas? Okay, so these are all intact with no tenderness noted, no drainage, no swelling, no masses or lesions on them. With an otoscope, I would insert it upside down at a 7 o'clock angle towards the nose, pulling the pinna back, looking in for an eardrum that is gray, pearly, and shiny, and an ear canal that has no redness or drainage. Comparing it bilaterally with the other ear, if you're going to turn the other way for me. Looking at the pinna, the tragus, and the mastoid. Any tenderness here? Okay. So, as well with the otoscope, inserting it upside down, pulling the pinna back, and angling it at about a 5 o'clock. Looking through, trying to find a eardrum that is gray, pearly, and shiny, and an ear canal with no drainage, lesions, things like that. And like I said, I would compare those bilaterally. With the hearing test, this is the whisper test. I'm going to stand about 2 feet behind you, and I want you to cover one ear, and I'm going to whisper a series of 3 letters, and I want you to tell me what they are.
CCQ.
Okay. Other one. B, L.
BLQ.
So the hearing test is done. Next, I'm moving to the nose. It looks symmetric to the face. It looks like it's intact. There's no deviations. Looking onwards, no drainage that I can see from here. I'm going to lift your nose back. I'm going to shine the light. There's no deviated septum, no lesions or masses inside. As far as the mouth, I'm going to take my tongue depressor, depress down the tongue and look at the back of your throat, and I can see it. Go ahead and open your mouth one more time for me. Okay, and your gums. Okay, so I can see the uvula. The throat is pink and moist, no redness, no white patches. The tongue is pink and moist, as well as the hard palate and the gums. No lesions inside there, no bleeding. He has good control of his tongue. The teeth are a whitish yellow color, and all of them are intact. He's not missing any teeth. Looking at his lips, they're pink, moist, and intact with no lesions or masses on those either. There's no dry, cracking, anything abnormal. I'm sorry. There's nothing cracking there, so it looks good. They look moist. Okay, so now I'm going to look at the neck. I'm palpating the carotid pulse on this side as well as this side. I have a 2+ on both sides bilaterally with a regular rate and rhythm. Kind of looking at the neck vasculature. It's the neck symmetric on both sides. He has muscle control. Then I'm going to feel the trachea. It is midline with no deviation or tenderness. I cannot palpate the thyroid, but I'm going to have him take a drink of water, and the thyroid and trachea should rise and fall as he swallows, which does happen. So next I'm going to go to the lymph nodes. So I'm going to start here with the pre-auricular, post-auricular, occipital, tonsillar, submental, submandibular, superficial cervical, posterior cervical, deep cervical chain, supraclavicular, infraclavicular, central, lateral, pectoral, and suprascapular back here. Those are not palpable. Did you have any tenderness whenever I palpated those? Okay, so no tenderness noted. The next thing that I'm going to do is look at the back of him, the anterior or the posterior thorax. I'm sorry. Just gonna go ahead and kind of inspect it from what meets the eye. I don't see any masses or lesions here. The skin is a nice tan pink color. The temperature is warm. He has dry skin, nothing too moist, nothing wet, mottled, things like that. I don't feel any masses. There's no tenderness noted whenever I'm palpating here. As far as percussing, I'm going to percuss along the back. So, whenever I percussed, I can feel some resonance, which is felt whenever they do percuss the lungs. Next, I am going to do the tactile firmitis test. So I ask the patient to say 99 every time that I touch the back. It's going to be 5 on this side and 5 on this side. So every time I touch, say it, please.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so those are vibrations. I don't feel anything to increase or to decrease. They are just vibrations that I can feel. So now I'm going to take a listen in the 10 different lung fields in the back. So you can just breathe normally for me. So the lung fields are clear. I don't hear any crackles or wheezes. Now I'm going to put my hands here. I want you to take a deep breath for me. So my hands rise and fall with the chest. He has a good symmetric chest from here. The AP diameter is 1 to 2. I don't see any labored breathing. It has a symmetric rise and fall. No retractions from this side, from this angle. I'm going to go ahead and test the costovertebral angle, the 12th rib. Do you have any tenderness whenever I do that?
Mm-mm.
Okay. So testing filling of the spinous processes in the supravertical muscles. When I go down the spine, I can feel the processes all the way down. No tenderness noted. I can feel the muscles all the way down. And there's no tenderness noted there either. I'm going to turn towards me real quick. Kind of the same thing, looking at the front, inspecting it, trying to kind of palpate it, seeing if I feel any broken ribs, any protruding bones, and I do not. It feels flat. Skin color is still the tannish pink, no moistness, it's dry, the skin is intact. So I can see an equal chest rise and fall. The respiratory rate is 18. No retractions, unlabored breathing. And now I'm going to go ahead and listen to the lung fields. There's 8 different ones on the front. So the lung fields are clear through there. I don't hear any wheezes or crackles, as I did not hear on the back as well. So as I said, the breathing is unlabored and a equal chest rise and fall. So now moving on to the landmarks for the heart. I'm going to listen to those. The first one's the aortic. It is the second intercostal space, right sternal border. I'm listening to these divided like a 2 plus with a regular rate and rhythm and a 2 plus amplitude. Next one is the pulmonic. It is the second intercostal space left sternal border, right across. 2 plus with a regular rate and rhythm. Down one, that is the Erb's point. It is the third intercostal space left sternal border, 2 plus. Fourth intercostal space left sternal border is the tricuspid, 2 plus. And then I'm going to palpate. This is the PMI. This is the point of maximum impulse. This is the best way to hear the heartbeat. It's also the mitral or the apical pulse, which is the fifth intercostal space midclavicular line on the left side. So I'm going to listen here for 1 full minute. Counting it. So the pulse is 82. That is a regular rate and rhythm. Just kind of looking at the pericardium area, the skin is intact. There's no lesions or anything. Palpating it, it feels to be flat with no protrusions here. Okay, so now I am going to look at the arms. So these are the upper extremities. Just kind of looking at these. The hair is distributed evenly. The skin color is a good color for the ethnicity. Looking at the hands, the fingers, no clubbing. There's a capillary refill of less than 3 seconds. Nail angle of 180 degrees. Pulses in the radial area are 2 plus. Pulses in the brachial are also 2 plus. Looking for any abnormalities on the skin, and I don't see any. There's no lesions or protrusions here either. So I'm going to have you lay flat for me. I'm going to look at your abdomen. Okay? Looking at the skin color, it is the same tannish pink color. The temperature is warm and the skin is dry, no moistness. The first thing that I'm going to do is I'm going to take a listen to the vowel sounds with the right lower quadrant being the first place I listen. Normal active, right upper, normal active, left upper, normal active, and left lower. These are normal active. And now with the bell of my stethoscope, I'm going to listen to the aorta, the 2 renal arteries, and the 2 femoral arteries. Over the aorta, I'm going to listen here. That's a 2 plus. The right renal, 2 plus. Left renal, 2 plus. Right femoral, 2 plus. And left femoral, 2 plus. So to start out, I'm going to percuss the abdomen in all 4 quadrants. So I should feel a little bit of tympany over the bowels. Starting with light palpation in all 4 quadrants. I'm just going to lightly palpate. Any tenderness? Okay, now I'm going to deeply palpate. Any tenderness? Okay, starting on the right costal margin over here to feel the right lower border of the liver. And I can feel it. The aorta, which is midline, I'm going to feel for any pulsation. Okay. The femoral artery over here. And then the other femoral artery over here. Okay. Now I'm going to do a hernia assessment with the diagnosis. So I'm going to put my hand right here, and I want you to raise your head for me. And I don't feel anything as far as a hernia. Go ahead and do it again. Okay. Go ahead and lift this down for me. Okay, and you can stand back up. Okay, now looking at the lower extremities here. So the skin is intact. It's a tannish pink color for his ethnicity. The temperature is warm and they're dry. Looking at any of the joints here, assessing any edema. I do not see any edema present. I'm going to palpate the pedal pulses. There are 2+, and the posterior tibial. These are 2+. Capillary refill on all toes. This is less than 30 seconds. So now I'm going to do the cranial nerves. So the first one, I'm going to do the olfactory, which is the first cranial nerve. So I'm going to have you close your eyes, and I'm going to have 2 spices for you to smell, okay? I want you to tell me what they are. Okay, next.
Coffee.
So the first cranial nerve is intact. Next is the optic. So previously, whenever I used the ophthalmoscope, I assessed the red reflex with the right eye and his right eye, the left eye and his left eye. So this time I would use the ophthalmoscope to visualize the fundus, noting the color, size, and shape, and also to assess this, I'm going to have him stare at my nose and test the confrontation. So in your visual fields out here, I'm going to show hold some numbers up, okay?
3, 2, 1, 5.
Okay. So the second cranial nerve optic is intact. 3, 4, and 6 is the oculomotor, the trochlear, and the abducens. So for this, I have a couple of tests for you. The first one is the 6 cardinal fields of gaze. So I want you to start here. I'm going to move my fingers up, follow it with just your eyes. Okay. Next, I am going to just have you stare right at my nose and keep staring at it for a fixed gaze. I'm testing to see if you have any nystagmus, and there's no nystagmus present. Next, I'm going to take just a card here, and I want you to keep staring at my nose, and I'm going to cover one eye, and whenever I uncover it, I'm testing to see if there's any movement, okay? And there's not. No movement on that side either. So 3, 4, and 6 cranial nerves are intact. The 5th cranial nerve is the trigeminal, so go ahead and tighten your jaw muscles here, clench your teeth, okay? So I want you to close your eyes. I'm going to touch your forehead, cheeks, and jaw with something sharp or dull, and I want you to tell me which one it is, okay?
Dull. Dull. Sharp. Dull. Sharp. Dull.
Okay. So 5 is intact, trigeminal. 7 is facial expression, so I want you to smile for me, frown, puff your cheeks out, and wrinkle your forehead. Okay, so the facial nerve 7 is intact. There's no exaggeration there. For the 8th one, it is the auditory. So I'm going to use the tuning fork here. The first one's the Weber test, and it's the midline of the cranium. So I'm going to strike it, and I want you to tell me if you can hear it. Okay. The next one is the Rhines test. It's at the mastoid in the little earlobe right here. I'm going to strike it. Okay. Alrighty. So the 8th cranial nerve is intact. 9 and 10 is the glossopharyngeal and the vagus nerve. For these, I'm going to shine a light so I can visualize your uvula. I want you to say ah. Okay, so the uvula moves. I'm gonna have you drink a drink of water and swallow that for me. Okay, so you adequately swallow and your gag reflex is there. The 11th cranial nerve is the spinal, so I want you to shrug your shoulders. Move your head side to side. Okay, that one is intact. And the last one is the hypoglossal. So stick out your tongue for me and move it side to side. Okay, so the 12th cranial nerve is intact. Next, we're going to the musculoskeletal assessment. So if you want to go ahead and stand up for me. I'm looking at your shoulders. They are not grossly deformed. They're symmetric with the body. I don't feel any warmth or anything here. Iliac crests, they're not grossly deformed either. No warmth or anything there as well. They're symmetric on both sides. Go ahead and turn to the side for me. I'm going to look at the curvature of your spine. I can see a little bit of a dip here at the cervical, outward at the thoracic, and another dip here at the lumbar. So go ahead and bend forward for me. I'm going to look at your spinal, how your spine runs. Run my fingers alongside of it. And it's normal. I was testing for scoliosis, but not normal. Your spine is straight, so that means that you do not have scoliosis. Next, I'm going to test the range of motion of your spine, so I want you to bend forward for me. Bend backwards, side to side. Okay, for your neck, for your cervical, I want you to bend it forward, backwards, side to side. So you have a range of motion of your neck and spine. Next, I want you to raise your arms, lower them, bring them out, bring them back in. So you have range of motion of your shoulders. You can go ahead and sit back down for me. I want you to raise your shoulders. I'm going to test your trapezius and your sternocleidomastoid muscles. I'm going to push against it, so raise them. Okay. So you have strength of 5 on the grading scale for those. For your TMJ, which is your temporomandibular joint, I'm going to locate it and open it for me and close. Okay, no crepitus, popping. Do you have any tenderness? Okay, no tenderness noted. Okay, so next I'm going to look at your upper extremities here. I'm going to look at all your joints, your finger joints, your wrist joints, your hands, your elbows, and your shoulders. So I'm looking for any warmth, redness, crepitus, or swelling or tenderness. And I don't feel any crepitus here, or warmth, no crepitus, no crepitus. I didn't feel any warmth, redness, or swelling there. Just looking at your joints here on your fingers as well, just kind of checking them out. Okay, so I want you to hold your arms out and bring them in, back out, and then flex your wrists, extend them, bring them in, bring them out, and then a roll. Okay, make a fist, adduct your fingers and adduct them, bring them back out. So he has resistance here. He has a 5 of strength here. Bring here. I'm going to pull and push. Okay. So on his upper extremities, he has adequate muscle tone of 5 on this grading scale. Okay. Next, I'm going to go to the lower extremities. I'm looking at the feet joints, the ankles, the knees, and the hips for any crepitus, swelling, warmth, or redness. I don't see you feel any warmth here, any crepitus, nothing here. No redness or crepitus, swelling noted, as well as here. Okay, so as I said, no crepitus, redness, swelling, warmth in any of these joints here. I'm gonna pull against your legs, push, pull. You want to stand up one more time for me. Now have you bring one leg out, in, out, in. Bend your knee, bend your other knee. Okay, so full range of motion of his lower extremities and a 5 on the grading scale with adequate muscle tone for his lower extremities. Next, I'm going to go to your cerebellar and sensory. So we're going to assess your gait and your balance. So if you want to walk right back there and turn around and come back. I'm looking to see if he has any limp, if he has any ataxia, but it looks like he has good control over his muscles and he has a steady walk. Now we're going to do the Romberg test. So if you want to stand on one leg for me and close your eyes, just hold it there for a second. Just making sure he's safe. Go ahead and do it with the other leg. Make sure he's safe. Okay. So he has a little bit of a sway, but he does have a negative Romberg test because he has intact balance and cerebellar function there. Next, I want you to do a heel to toe walk, please. Okay, so that shows us that he has cerebellar function. And next, go ahead and stand on one leg again for me, just to show. Okay, so that's the other one standing on one leg to show that you have cerebellar function. Next is the fine motor coordination. So the first one I want you to do is the finger to nose. So I'm going to hold my finger out, touch my finger, and then touch your nose. Okay. Okay, so he has fine motor coordination intact there. Next, I want you to take each of your fingers and touch to your thumbs and go back. Okay, fine motor coordination is intact there as well. Next, you can go ahead and sit back down for me. I'm going to have you do sterignosis, which is I'm going to place one object at each of your head one at a time. And I want you to tell me what that object is with your eyes closed, okay? So your right hand, I'm putting something in it now.
Coin.
Okay, that's correct. And then next is left hand.
Paperclip.
Okay, thank you. Next I'm doing graphesthesia. So I'm going to take your hand and I want you to tell me what letter I trace in your hand.
E. B. B.
Okay.
C. L. S.
Okay, so that's intact there. I'm going to do the sensory function here on his upper extremities and lower extremities. First, I'm starting with the upper. I'm going to have something soft, sharp, and dull. And I want you to tell me which one it is first. So let's start up here.
Sharp.
Okay.
Dull.
Okay.
Soft. Soft.
Okay. So you have good sensory. You have sensory function intact there. Next, I'm going to. I'm going to strike this with the vibration. I want you to tell me with your eyes closed as soon as you feel it on your joint and as soon as it stops, okay?
Yep. Nope. Yep. Nope.
Okay. Next, I'm testing the position of his joint. So with your eyes closed again, I'm going to lift it up or down. I want you to tell me which one I'm doing, okay?
Up. Down. Up. Down. 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 Up. 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 Down.
Okay. Next, with the lower extremities, same thing with the sharp and dull.
Sharp.
Okay.
Sharp.
Okay.
Sharp. Soft.
Okay. Next, I'm going to do the same with the vibration. So let me know as soon as you feel it when it stops.
Yep. Nope. Yep. Nope.
Okay. Same thing with the toes lifted up and down, okay?
Up. Down. 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 Up. Up. Down. Down. Up.
Okay. So sensory function is intact here. Next, I'm going to do the reflexes. I'm going to test these bilaterally. So the first one is the brachioradialis. I'm going to hold the thumb here and I'm going to strike. Okay. Reflex of 2+. Testing it bilaterally. Reflex of 2+. The biceps. Okay. Reflex of 2+. Reflex of plus. Triceps. Let your arm go dead. Okay. Reflex of 2 plus. Let your arm go dead. Okay. Reflex of 2 plus. Next is the patellar. So I'm going to strike your knee. Okay. There was a reflex of 2 plus. Okay. Reflex of 2 plus. Achilles. Reflex of 2 plus. Reflex of 2 plus there. Next I'm going to do the Babinski reflex. I'm going to run something across the foot. Okay. Okay, so his toes curled just a little bit. That is the sign that we look for. So I think I'm going to take a peek at my cheat sheet and see what I got here. Okay. Just checking. Okay, so a couple of things I would have done. The abdomen assessment, I would have looked at the contour on the patient's right side to make sure that it was a flat contour with no protrusions or scaphoid shape. Also, the knees would have been flexed during that assessment. And also I would have assessed the maxillary and frontal sinuses. So I'm going to go ahead and do that now. These are the maxillary and tenderness here. And then frontal and tenderness here. Okay. So I think that is it.